Folks, this is Mary Sue with Michigan Parkinson Foundation. I'm going to mute all of you because you're getting some background noise. Lori, when I mute everyone, then please unmute yourself and then I'll introduce you, okay? All right, I just muted everyone. Now, Lori, go unmute yourself. You good, Lori? Okay.
I think so.
Okay, we are delighted to have Lori Wells, who is the Community Outreach Director for PACE North. PACE stands for Program of Inclusive Care for the Elderly. I heard Lori speak at our support group leadership training in Traverse City this past summer, and she has great information about this program that is offered throughout the state of Michigan that I thought would be very beneficial for our folks to learn more about. So I'm going to give this over to Lori Wells. Thank you, Lori, so much for being with us here this evening.
Thank you. It's my pleasure. I'm coming to you from the basement in my house. So if the cat wanders across the screen, you'll probably be used to that. That happens sometimes when we're Zooming from home. So thank you for having me. I'm thrilled to always talk about PACE to anybody who will listen. Not to be too picky, but PACE actually stands for Program of All Inclusive Care for the Elderly. So you got to get that all in there. PACE is, we're new. We opened in October of 2019, but there have been PACE programs across the country for over 50 years now. And in Michigan, we have 14 other PACE programs that have been here since about the mid-90s. So although PACE North is new to Northern Michigan, the PACE healthcare model is certainly not new, but just finally got it into the Northern Michigan area. So what PACE is, in a nutshell, it's a managed healthcare plan. So when a person enrolls in a PACE program, we act as the primary care provider and the insurance company. So what happens is the enrollee is assigned a primary care provider through our program. We have our own nurse practitioners and medical director, and that becomes the person's family doctor. So they don't go to their own family doctor anymore. They come to PACE. So if they're not feeling well, they call PACE and we make arrangements to go get them and bring them into the center, or we tell them, you know, what they need to do to manage whatever symptoms they might be having. And then if they need other doctors or other specialists, then that goes through our primary care provider at PACE. So if they have cardiologists or dermatologists or foot doctors, that kind of thing, the primary care provider at PACE will order an appointment with one of those providers, and then the appointment is paid for, just like, excuse me, just like if I'm going to see a provider with my own insurance, they have to be an approved provider. The other doctors that our participants see have to be approved providers through the PACE program. So it's kind of confusing, but I'll try to clarify. Excuse me. I have a tickle. Excuse me. So let's just try to imagine, I'm sorry, Mary, I have a little bit of a tickle. I need to give a good cough to get rid of it.
That's okay.
I think I'm okay. Whenever you cough now, everybody looks at you and thinks you have COVID. So, you know, you're really kind of paranoid when you start to cough.
Even though you're in the privacy of your own basement.
I know there's nobody here to look at me.
I know. You're fine.
Thank you. Thank you. So when you think about a PACE program, you think about, so the goal of PACE is to help people remain independent in their home for as long as possible and avoid a nursing home or assisted living stay. So that's our goal, is to keep people living at home independently. So in order to do that, we have to provide a wide variety of health care services. So if you think about the kind of services that are provided in a nursing home, a PACE program will offer those same services. The difference is the person lives at home. They don't spend the night with us. We close at 5 o'clock. So we have social workers, we have physical therapists, occupational therapists, we have a dietitian, we have clinical nurses, we have home care, a home care staff, we have certified nurse aides. We have the whole, everything that is provided in a nursing home, we provide through the PACE Center. Some of our participants come to the center and get care, and some of our participants get everything they need at home. Everybody is different. It just depends on the situation. But the idea is we are a center-based model. So we believe in the importance of socialization, especially during this pandemic time, that it's important for people to get out and socialize. And so we do have a day center at PACE, much like if you think about a senior center and what a senior center has to offer, we have the same type of day programs at PACE. So they'll go, we do some field trips, we have exercise classes, we have card groups, we have movies, we have speakers come in, all kinds of different activities going on for folks that come into the center. Some people will come, some people come every day, the Monday through Friday. Some people come once a week, some are twice a week. Some only come when they have a doctor's appointment. So how often people come to the day center is determined by the care team, what the need is, and of course, what the participants' willingness to participate is. So when a person is considering PACE, they will meet with a nurse to determine medical eligibility. And then our care team will develop a care plan that will clearly outline to the participant, what services are going to be provided for them. To be eligible for PACE, you have to be 55 or older, and you have to live in our service area or the service area of the PACE program that you're looking at. So our service area is 7 counties. We serve Antrim, Benzie, Grand Traverse, Kalkaska, Leelanau, Manistee, and Wexford counties. The service area is determined by the state of Michigan, and it's based on that a participant should not have to travel more than 60 minutes to get to the center. So our center is located in Grand Traverse County right now on Garfield Avenue. It used to be the old health department, and it's been renovated to hold the PACE program. And so we serve the southern part of Antrim County and the northern part of Manistee County, because if we went too far in either direction, we'd be over an hour to get to our center. So the state determines that service area. And it goes by zip code. So we have a tool on our website at pacenorth.org. If you're looking for the PACE center that serves your area, it asks you to put in a zip code. And when you do that, it'll spit out the PACE center that serves that zip code. We're the most northern program right now. Excuse me, Judy, you mentioned that you live in Alpena. Right now, Alpena does not have a PACE program that covers that service area, but I believe there is one being explored. So hopefully there will be one there before too long. And then there is no other program north of Antrim County. And we're kind of like the dividing line. It's kind of like where 75 comes up through the state of Michigan. So it certainly is the PACE Association of Michigan's goal that there would be a PACE center that would serve every Michigander, in the words of our governor. But as it is right now, there are 14 centers serving our state right now. There are, I believe it's 38 states that have a PACE program. So not even every state has a PACE program available to them. So I feel like we're really fortunate to have this as an option for care. I ran the senior center in Traverse City for 30 years prior to coming to PACE, and ran into a lot of different situations with folks that had there been this program in our community, would have benefited greatly from it and been able to avoid nursing home placement prematurely. Most of our participants are Medicare and Medicaid eligible. They're called dual eligible. At the same time, most of our participants, when they come to us initially, do not have Medicaid. So that's part of the process with us, is we help people apply for Medicaid, help them with that process as far as the application, filling out the application, gathering the paperwork, and helping them with submitting it. Sometimes the application process can be complicated, in which cases then we of course refer people to elder law attorneys. In Michigan, a senior has, or an adult 55 and older, has to have an income that is under $2,382 a month to qualify for PACE and Medicaid for PACE. And the assets they have to be under $2,000. So, something that I've always talked to seniors about even when I was at the senior center, is that it's really important to, talk to an elder law attorney before you need to do anything, because there are look back periods where, there's certain things that you can do with your assets that are acceptable by the state of Michigan to protect those assets should you need Medicaid down the road, whether it's for home-based community service like ours or a nursing home in the future. So it's always good to talk to somebody before you need the service so that you can be prepared if and when you ever do need to access it. The people who come to our program, we have people that are in their late 50s. We have somebody well up into their 90s, or actually we have two people that were 100 actually. So we have quite a wide variety of acuity levels and ages. Like I said, some people only come into the center when they have a doctor's appointment, so they're fine on their own, doing their own thing at home. We have others that PACE plays a big role in maybe providing respite care to a caregiver at home that's with a loved one. And it gives that caregiver a break if we can bring their loved one to the center and take care of some personal care needs. They could see the doctor, do some activities, kind of, give them a full day. They go home fed and tired from a long day, then they sleep better. And then the caregiver is able to have the energy that they need to continue, caring for them in the days that follow. Some of you may be familiar with My Choice Waiver. We're a similar program to that as far as eligibility goes. The main difference there is that we have a center. So we have a place for people to come, and we also become, like I said, the primary care provider. So that's probably the number one barrier I would say that I've seen when people are considering PACE, is they're reluctant to give up their primary care doctor. They have a relationship with them. But I talk to people quite a bit about that because, nowadays when we go to our doctor's office, a lot of times we don't see our doctor. We see their PA or their nurse practitioner. If we go to the hospital, our doctors don't follow us at the hospital anymore. So the relationship, I think, is different with our doctors today than it might have been, 20 years ago. But I also talk to people about, you're giving up that one primary care doctor, but you're gaining a social worker, you're gaining a nurse who's assigned to you, you're gaining a nutritionist, a rec therapist, a physical therapist. All of these people make up what we call your interdisciplinary team, and they work together as a team to coordinate whatever care needs you have. When I mentioned earlier that most of our participants are dual eligible Medicare and Medicaid, when they are dual eligible and enrolled in PACE, anything and everything that's required for their medical care is covered by the PACE program. There is zero out-of-pocket cost, no deductibles, no premiums. You don't get paperwork at home saying that 20% of this was paid and 80% of that was not, or vice versa. The EOBs from Medicare don't come anymore. all of your healthcare needs are going to be paid for through PACE. We become the insurer for you. So for a lot of our people have said, you know, what a relief that is to them to not have to deal with all of that paperwork that they you know, you go to the doctor for a checkup or a physical and you get months worth of paperwork that keeps coming month after month to pay for all the little pieces that, that for whatever service they might have provided for you. So that's a big relief for people. One of the other important elements that we provide is transportation. That's a key service for folks. So when we talked earlier about making doctor's appointments for folks, we make those appointments for you. We actually have a scheduler, Karen, who's just fantastic. Karen makes those appointments for you because if you need a ride, she's making sure that that appointment is at a time that our transportation is available so that we can come pick you up and take you to that appointment. Not everybody uses our transportation. Some people use it for one way. Maybe the daughter's going to meet at the doctor's office and the daughter will take you home from there, or you know, they might take you to the appointment but need PACE to pick you up. But in most cases, you know, we pick people up at their home and take them to the appointment and then take them home afterwards. We have some people who are on dialysis. So we're making really early bus runs early in the morning to get people to their dialysis appointments. Anything and everything that is needed or required for a person's medical care is going to be managed through the PACE program. I mentioned earlier, the eligibility piece about 55 and in our service area. Another piece to that is that you have to require our service. So that's where the nurse assessment comes in and we'll send a nurse to the home to do the medical assessment, and she determines if in fact the person requires a level of care that would make them eligible for PACE. Now, the way the standard is written for the state of Michigan, it says that the person requires a nursing home level of care. And that frankly tends to scare some people off because as soon as they hear that, they think, well, I don't want to go to a nursing home. I don't need nursing home care. Well, the idea is that you have a medical need that requires a supervision of a clinician of some sort. So maybe it's managing your medications. Maybe it's you have complex health issues that needs to have regular supervision of a medical provider. Maybe you require some therapy to maintain your strength to live at home. So there's a lot of different reasons that can determine a person is nursing home eligible. That does not mean that you're going to go to a nursing home. It just means that by the standards of the state of Michigan, they have determined that you need a certain level of care to maintain your independence, and PACE can help meet that standard of care. What I wanted to do is show you a short video. It's just 2 minutes long. That kind of puts everything I said kind of into a nutshell in simple terms to kind of walk you through the whole process. And then we'll come back and give some more information and answer some questions. So Mary, if you could start the video.
Working on it. Hang on. Not there. Give me a minute. I had it before.
Yep, we know it's there.
Yeah.
I think you minimized it. Is it down on the bottom of your
Yeah,
screen?
it is. It is. And when I hit share this time, share screen.
Are you still the presenter? You didn't make me the presenter.
No, I'm still the presenter. That's not it.
If you can't get it, that's okay. I can just talk through.
No, why don't you go on for a minute and address some other things? I will get it up. I had it there before. Sorry about this.
No, that's okay. I get it. This is what happens. Okay. So a typical, let me see, how do I want to say this? So we refer to the people who enroll in PACE as participants. And that's very intentional because people participate in their care with us. So we're not here to take over the care or to tell people that they have to do something that they don't want to do. We are there to help manage your care, your health care needs, and you are, as a participant, actively participate in those decisions. So if at any time the team should make a decision about something that you either need or don't need, and you disagreed with that, they would help you appeal that decision, which is something that I really, really like about PACE, because when they develop this care plan and say, okay, Judy's going to come to PACE, she's going to visit the day center 2 days a week, home care is going to be provided 3 hours a week, and she's going to get a power wheelchair to address her mobility issues. If she said, hey, I don't want to come to the center 2 days a week, I just want to come in when I have a doctor's appointment. If our team says, but we think you need to be there twice a week in order for us to take care of you, and you don't want to do that, then you can appeal that decision. And they would help you fill out this piece of paper that says, hey, I don't want to come in 2 days a week. Or it could be the opposite. You may say, I want to come 5 days a week. I don't think 2 is enough. I want 5. And then that decision can go to the state of Michigan, and they make sure that we're really prescribing you what you need. And so what I tell a lot of people is that you're going to get what you need. You might not get everything you want, which is what's said to be true for all of us, even with our, with whatever insurance company you might be dealing with. The insurance company determines what's allowable. And we are your healthcare insurance company now. So we may say, we're going to provide this. And if you wanted something different, you can appeal it, or you could. So we had one person one time that needed glasses, and we allow so much for a pair of glasses, and they wanted, all the bells and whistles. They wanted a certain type frame that had some embellishments on it. They wanted the kind that fade in and out. And so we only provided a certain level, but they were able to get the other glasses and just pay the difference. So you participate in that care, you participate in the decisions, and you work very closely with the team, a team of people who are making those decisions. Well, you're making some progress. We're back to the email.
Yeah, but that's not the way to do it. Oh boy. Emily, are you on the call? Let's see.
I'm here, but I'm on my phone, so I wouldn't be any great help real quick.
I tested this earlier and I got it, and now I want to. You're not seeing it, are you?
No.
No.
We started to hear it, but I don't see it.
Yeah, it's the same.
It's exactly what happened before. So all you have to do is exactly what you did before.
I know, and I can't seem to. Oh, folks, I'm sorry.
Well, why don't we, while you're doing that, maybe if we have any questions, let's see if
Yeah,
anybody
go
has
ahead.
questions before I go further. Does anybody have any questions?
Yeah, I have a question. So how do you decide whether you're better off going or, applying to have everything handled through PACE versus what your current insurance would be?
Yeah, so you have to kind of consider what your current insurance is paying, covers and pays for. So generally, I mean, like if I just use my own insurance as an example, they're basically just gonna push the papers, right? If my doctor sends them a a bill, then they're going to decide if they're going to pay for part of it, not, and send it back, that kind of thing. So they're just kind of a processing department, I guess.
Mhm.
Where with PACE, I mean, we're actually providing your care. So you have a team of people that are helping you manage your care and making decisions for you that are going to help you remain independent in your home as long as possible. So for instance, an example that I like to give, because it's a real one and it comes up frequently, is somebody suffers a stroke and they need therapy to get their strength back, to get back to taking care of themselves. Medicare, Blue Cross, Priority, any of those, they say they're going to pay for X amount of days in a nursing home or a rehab center, or so many visits a year for therapy, period. It's not based on what you need. It's just based on a formula that they've come up with that say you get, 90 days in a nursing home and 24
If you're
visits a year
lucky.
for therapy. If you're lucky, yes.
Yeah.
Where with PACE, if that's what you need and the case can be made for that's what you need, then that's what we're going to provide and that's what we're going to pay for. So we've got people that are in therapy, since we started, still doing therapy because it's what they need to be, to keep their strengths up or to keep themselves independent at home. So it's not based on a formula. It's based on what the participant needs. And the example that I use a lot is that we are an insurance company for sure, but we're also your provider. And when we make a covered for your care, it's made by 11 people who are your team care providers. It's not somebody up in Nebraska sitting at a big desk making up formulas for all of us in the country that we have to follow. It's 11 people who you know their names, they know you and your name, they know what's going to be best for you, and they're making the decision about, how much therapy you need or how many days in rehab you need, or, whatever the case is. So you really get that personal, personal attention, personal care. Like our physician, we have 3 primary care providers on our team. We have 140 clients right now. So doing the math, that's 40 people per provider right now. Most doctors' offices are managing hundreds of clients or even thousands. So, your care team is, very focused on you as a person.
So say that you're dealing with somebody with Parkinson's who's been going to a neurologist for years, then your team takes over that. Do you have, motor or movement disorder specialists on your team?
Yeah, so we have a contract with Dr. Is it Robbins or Robins?
Robins. It's
Robins.
Cornelius Robins.
Yeah, so he's the doctor that we have a contract with that would handle our Parkinson's participants. Which from what I understand has been a preference of the people coming to us. So that's a good thing. I'm glad we have him because people are usually happy about that. But if someone were to come to us, and this has happened where their neurologist is somebody out of the University of Michigan in Ann Arbor, and they want to continue to go to that person. If it's just a matter of preference, there's not a medical reason why they have to see that person in Ann Arbor, PACE is likely not going to support that. They're going to say, we have Dr. Robbins. I'm sorry. I keep getting it. Is it Robbins?
It's Dr. Robins, and just
Robin.
and to make I want everyone to know he is a movement disorder specialist. He did a 2-year fellowship many years ago. He has just joined our professional advisory board, and several of the University of Michigan doctors asked me to recruit him. He's very, very highly thought of. So you've got the right guy up there as a consultant.
Okay. So yeah, so we, we would say we would want this person to change over to Dr. Robins, and he would take over that particular type of care. Mm-hmm. Now, if they were we had somebody who was seeing like a retinal specialist in Grand Rapids somewhere, and there was not a specialist of that nature in the Traverse City area. So we did approve them to continue to see that physician and covered, the costs associated with that. The thing that gets tricky with that is mainly really transportation. So if it becomes a thing where we're being asked to drive somebody to Grand Rapids, send a staff person along with them to supervise them and bring them back, then that, we have to look at that kind of stuff. Can we really sustain that? But most in the cases that come to my mind right now, when we've had contracts approved for out of the area, family has taken the person to those appointments. And so transportation has not been a factor. So if there's a medical necessity for it, then it will be considered, but we have hundreds of contracts in the area with local providers. So we really have not had too much issue with somebody saying, hey, I see this person for my cardiologist. And we've had a contract with them. So it really hasn't been a big problem.
Mm-hmm. So how are you funded? I mean, what do the people who become participants in PACE, how do they pay for whatever they have to pay for?
Yep, that's a good question. So the funding for PACE is similar to how a nursing home is funded. So we are funded with Medicare and Medicaid dollars. So we receive a capitated rate for every participant that we enroll in the program, and we're responsible for all their healthcare needs. So if we have, I mentioned before that most of our participants are dual eligible for Medicare and Medicaid. We have about 5% of our participants who do either pay privately or they have a long-term care insurance policy that pays. And so in those cases, right now, the private pay rate for our region is $5,300 a month. So a person that pays privately at PACE North is going to pay $5,300 a month, and that will include all of their medical needs that come up during their stay with us. So that's their prescriptions. If they needed heart surgery, that's going to get paid for from us. If they need an x-ray, if they need blood work, if they need home care, whatever healthcare needs they have, they're paying that $5,300 up front, and then, PACE is taking care of the rest. That's just how it works in a nursing home too. So if that same person wasn't in PACE but needed that level of care, were to enroll in sign up and live in a nursing home, they might be paying $8,000 or $9,000 a month for all that same type level of care and residing at the nursing home. So the rationale for PACE, yes, it's still expensive if you pay privately, but if you're faced with either that or going to a nursing home, it's less than a nursing home, and you get to stay living at home, which is what people want. And so, for some people, that is the best option for them. And we will, on occasion, on a few different occasions, we've had people pay privately for a couple of months to spend down their assets so that then they become eligible for Medicaid, and then they apply for Medicaid, and then the rest is, then they're covered by Medicaid from there on out. So that's happened more than a couple of times.
Okay.
I think, Lori, do you see the screen?
I see the screen. I see my email.
You still don't see the video. Okay, never mind. The way it's showing on mine, sorry. Okay, keep going. I thought I had it. Laura, you're on mute.
There we go. I must have sorry about that. I'm trying to think what else I want to say. So a typical, oh, there we go.
You're kidding.
I see it now.
Okay. All right. Do you want me to play it now?
Yeah, that's okay. I think it will make it all make sense.
Okay, here we go.
Lisa works full-time and cares for her aging mom. Her days were spent doing housework, helping mom with personal care, making appointments, arranging in-home health,
Yeah, I don't hear it either. Looks like somebody else said they can't hear it. I can see it, but I can't hear it. I heard it for a little bit. Now it stopped.
Okay.
Mom's team makes sure she has the care, medical supplies, medications, equipment, and social enrichment that she needs for overall well-being. Lisa met with a Pace North enrollment specialist. She learned that the program is both health insurance and healthcare provider combined. Mom qualifies because of her age, and she lives in the service area. She needs help with mobility and transfers and has other health challenges. Mom can live safely in the community, such as her own home or an assisted living, and she agrees to receive her health and personal care from Pace North. Best of all, Pace North accepts either private pay or Medicaid. Lisa doesn't have to worry about how to pay for Mom's care as it increases. Now, Lisa can relax and enjoy her time with Mom. The Pace North care team handles all the details. Is Pace North right for your family? Find out. Call today.
Okay. I want to apologize for that. That was speeding up. The speed was bad. I couldn't hear it good. So I apologize, you guys. There's just some technical difficulties there. But I'm hoping that you at least got the gist of, I was starting to say like it's very common for us to hear from a son or a daughter who's trying to take care of mom or dad, and mom or dad has been fine all, up until this point, and they're starting to see a decline, and starting to see where they maybe are having a little more difficulty meeting those care needs on a daily basis, getting a little overwhelmed with the decisions they have to make every day. And things are just getting a little bit harder in general. That's a typical client to sign up for PACE. That's what we're there for, is to start putting in those supports that a person needs to just give them that little bit extra to keep them feeling comfortable and safe living alone at home. What's important to know about PACE is that we are not a 24 hours, 24 hours a day, 7 days a week type of home care service. If a person truly needs 24/7 care, that's really a nursing home client. So if a person really truly needs that much support and help in order to live at home, then that's not a PACE person. A PACE person needs to be able to maintain some sort of independence, living at home. That might be alone, or it might be maybe they live with family, but the family's not there all the time, or the family needs support in order to continue to be the caregiver. But if a person truly needs 24/7, then that really isn't, PACE isn't the right place to go. Now, I will say that once enrolled in PACE, if a person's care needs increase to the point where a person does need 24/7, because that does happen, obviously, if a person signs up with us and they have a certain amount of independence, but as time goes on, or maybe they have a stroke, or maybe something, else has happened that's diminished their capacity. There may come a time when a person does need that 24/7. And at that point, we would have a discussion with the participant and their family, and PACE may recommend placement. That would be a last resort for us, because like I mentioned before, it is our goal to keep people living at home. But if that's not safe during the course of their time with us, and we make a recommendation for placement, we would work with the family to find placement and help make that transition. Our doctor would continue to follow that participant, so they would continue to care needs. Obviously, the nursing home is going to do the hands-on care for them, but the doctor at PACE would continue to be their doctor. The social worker would continue to follow them. In some cases, we have people that are residing in nursing homes that still get picked up and are brought into PACE, because now they've got relationships with different people at PACE, so they want to come to PACE, so that does happen. So we're there to the end. So if a participant needs hospice care, end of life care, then we're going to help make those arrangements as well. So you wouldn't necessarily start out with PACE if you need 24/7 care, but if you're in the PACE program and you transition to a point where you do need that, then PACE is going to make sure that that's provided. So the question was earlier, like, how are we different from, your traditional insurance? That would be a big reason that we're different. We're going to stick with you and help you make those transitions to different types of care as your care needs change. Any other questions?
Yes. If you're on Medicare, are you eligible for the PACE program?
Yeah, so we talked a little bit earlier about what we call dual eligibility, and that means Medicare and Medicaid. So if a person is 65 or older, they're going to have Medicare. That's something that we get when you turn 65, you get Medicare. Medicaid is something that you have to apply for if you need financial assistance. And so if a person calls PACE and they don't have Medicaid, we talk about what their income is, and we make sure that it's under that $2,382 a month that I mentioned earlier. And then we talk about assets, and if they are within the guidelines of what's determined eligible for Medicaid, then we assist them with that application process. If a person is over assets, meaning, they have over $2,000 in assets, then we recommend that they talk to an elder law attorney and discuss ways to spend down those assets to get themselves eligible for Medicaid. And that's happening all the time.
What happens if you can't spend down all your assets?
Well, so there's options. I mean, like I mentioned earlier, some people pay privately for PACE then. So those they use those assets to pay for their care, and they pay PACE privately. Medicaid attorneys can, there are strategies out there to protect those assets and spend them down. Medicaid estate planning. And that's why we really recommend seniors, before you necessarily need care, consult with an attorney to see what would it take for me to be eligible for Medicaid if it comes down the line that I need it, what would be involved.
Thank you.
What if you still own your own home, but your monthly income is, what was it, $3,082?
$2,382.
2,000?
Yes.
That's awfully low. That's really low.
2,382. It's higher than a lot of the Medicaid benefits out there. So some people will come and say, I'm not eligible for Medicaid, I tried. So like if a person were to try to get food assistance, the income level is much lower than it is for PACE. But if their income is under 2,382 and they own their own home, Medicaid does not count their home against them. Medicaid.
Okay.
You can own a car and you can own a home.
Okay.
What I will say though is that Michigan is now an estate recovery state. So if those assets are not protected when a person dies, if they were on Medicaid, then the state of Michigan may seek out a recovery for costs from their estate.
Stuck way back there, you don't.
So that's why an elder law attorney is important, because there are things you can do to protect all your assets.
Okay.
But
A little better, but not really.
Okay.
I'm no attorney, so don't write down what I say and take it to court, because you'll lose. But in general, those are the rules.
Okay. So what is it, about $26,000 a year? Annual?
2,300 times 12, a
Yeah.
little more than that, but yeah,
Okay.
a little under 30,000.
Okay.
That makes them eligible. But if people have a pension on top of their Social Security, generally they're over income for that.
Yeah.
And that's something that, there is a state association for PACE, and that's something that our advocates are really lobbying for, is to address those income limits. Because it's heartbreaking when I meet somebody who makes $2,385. I can't help them. If it's $2, I can't help them. And that does happen. So it's something, because in a nursing home, they don't have those same income limits. You can have a patient pay amount where you'll be responsible for X amount each month, and then the state pays the rest. And that's something that, we advocate for PACE. The people who are over income, come up with a dollar figure that's reasonable, that they can afford, but still be able to take advantage of the benefits provided. Okay. So we are advocating for that, but right now it's pretty cut and dry.
Okay, thank you.
Mm-hmm.
Do we have any other questions?
I will also say that if you live in the Traverse City area, I would love to show you our PACE program. We do have the evening support group that meets there the first Tuesday of the month with Hetty Mulvang. They actually have their group meetings at PACE. But if you are interested in having a tour where you can kind of see it all, would love the opportunity to show you around. You can just call me up. Mary or Emily have my contact information. Hopefully they can share that with you. If you're not in the Traverse City area, but you live in another community where there's a PACE, I'm sure they would love to show you around as well. We tried to show you tonight is there, but there's also a virtual tour where you can click on it, and it kind of takes you through our whole building and shows you the therapy room, the clinicians, the clinic, the kitchen, the day center, all of that. So you can kind of, envision what it's like a day in the life at PACE Center.
Okay. Folks, in the chat box, I uploaded a document. It's a Word document, and I listed all of the PACE locations in Michigan. I believe there were 13 regions, and I think there's 23 actual sites. And so it's on that Word document with the addresses and phone numbers. Okay. You should be able to just click on that document and then save it to your computer if you want that. Okay.
Yeah. So some PACE programs have more than one center. So right now we just have the one center, but we definitely can, have a growth plan for PACE North and expect that we'll have another center within 5 years, most likely, and probably down in the Wexford County area, because we have a fair amount of people who are coming all the way from Cadillac and south of Cadillac to come to the center. So it's quite a ride.
Yeah, for example, like Metro Detroit area, there's 2 in Detroit and 1 in Southfield, 1 in Dearborn. So I think there's 5 or 6 in the Metro Detroit area.
Right. Yeah. And then they're all part of what's called PACE Southeast Michigan.
Right.
Yeah.
Okay. Do we have any other questions?
If you have a friend or a neighbor or a family member that's over 55 and, just kind of struggling a little bit to manage their healthcare needs, I would really just encourage you to have them seek us out. No 2 stories are the same. It's kind of hard to put PACE into a half-hour presentation because every case is really, truly very unique. We serve each participant differently because of their different care needs. So my message to seniors, like I said, I worked for 30 years in this community, is just that there's a new game in town, and there's a new option for people to maintain their independence longer at home and avoid the nursing home as long as possible. So tell your friends and neighbors, we need help spreading the word that there's just another tool in the toolbox to help age successfully. So that's kind of my message.
And, I want to reiterate something that you said earlier. You don't want to make these decisions when you're in a crisis situation. And that's unfortunately when most people make their decisions about their long-term care. Emily and our phones have been ringing off the hook since the beginning of the new year with folks who are in the hospital, who are being discharged to a skilled nursing, and there's very few beds because of COVID. The hospitals are getting rid of people probably earlier than they should. They're sending them to rehab facilities. There's lots of people who need a medic who cannot afford private pay skilled nursing, and they need Medicaid, and they've not been approved for it yet. So their family is scrambling. They're getting placed in a facility that's 40 miles away from where they live because it was the only place that had a bed. So do your homework now, do your research now, get your finances in order. This is something you hope you never need, but you don't want to be making these plans when you're in a crisis situation. So look into your options. I realize the income level for this is pretty low. It's $27,000 a year. And it sounds to me like it's for people who are just on Social Security, retirement income, and really nothing else. Would that be correct?
If they're going to apply for Medicaid. I mean, if they pay privately,
I'm
then
talking
yes.
about Medicaid. Yeah, I'm talking about Medicaid. Yeah.
Mhm.
So if you've got any kind of a pension from your employer or 401k, I would definitely go see an elder attorney to find out what you can do with your assets to protect them and see what you have to do to spend down. Because this is a great program. The idea is it's less expensive for the government to keep people in their own home. People do better in their own home than they do in a congregate community. And the socialization, all the services are there. This is a wonderful program. It really is. So find out ways that you could take advantage of it.
Yeah, definitely. And that's kind of where another advocacy effort is that, we're lobbying with our elected officials to allocate more funding to programs, not only PACE, but other home and community-based service programs where people can get care that they need and stay at home. Because one, that's what we want. And two,
Right.
the state is figuring out that it is cheaper, especially when we have family members who will help and will support. Why should I have to go sit in a nursing home when someone's willing to help take care of me? They can't do all of it, but if with support, they could keep me living at home. And so the state's figuring it out. And like I said, there'll be PACE programs, there'll be more of them coming. There'll probably be patient pay amounts later. And so we're just not, don't quite have all of that yet, but advocate to your elected officials if you have the opportunity that you want to stay home if you need care.
Right.
So I
Right.
have another question then after what Mary Sue was saying about being on just Social Security. So does it make a difference if you file your taxes jointly? Because like in our situation, my husband only has Social Security, whereas I get Social Security and retirement.
Yeah, so that's where now whenever we have a married couple looking at PACE, we have them talk to an elder law attorney, because yes, it does make a difference depending on who's applying for Medicaid. They
Mhm.
will allow more assets in the home when there is a married couple. And so, yeah, in the short answer is yes, it makes a difference. So you'll want to, have those conversations.
Okay.
So the $2,300 a month, that's just for the individual, not for the joint income.
Right.
So you could have like two people are making $2,300 each for their Social Security. Would they qualify like at $4,600 a month?
Yeah. Well, when you apply for Medicaid, you apply for the person.
Right.
So, yeah. So,
Do they look at the joint income?
No.
Just the person's income?
Yes, they're going to look at
Who
joint
takes care?
assets. They're going to look at joint assets. So if both
Okay.
names are on an investment account of some sort that's worth, $100,000, then that's going to be considered 50,000 of that's going to be considered, one of the spouses.
Okay, got it. Okay.
So
That's
there are ways, that's where your elder law attorneys come in, and there
Sure,
are ways to work
sure.
around that. But there's also look back periods where the state says, okay, did you do this less than 5 years ago? And if you did, then they're going to make you wait 5 years before, it's going to be allowed.
Yeah.
So
Okay.
Okay.
that's why advanced planning is important.
Yeah. Okay. So I'm in good shape. Yay.
I think we have an elder attorney on our board of directors. I'm going to send her a note tonight and see if we can get a follow-up presentation
Yeah, that'd be
specifically, about how to qualify, what steps you need to take to qualify. And I'm going to have her address the PACE program and what steps you need to take. So we probably won't have that until March. I got to get on her schedule, but she's extremely knowledgeable.
Yes, and make sure you call her an elder care or an elder law attorney. If you just call her an elder attorney, she'll think you're just saying she's an old lady.
She's she's young, hip, and a super, super smart lady.
What's her name?
She's on our board. What am I? I'm drawing a blank. Sarah Shimke.
Okay, she actually helped us years ago when we went to an elder care lawyer.
Was she helpful?
Yeah, in fact, I wanted to get a hold of her again rather than go to the guy who was much older, you know, back when we did all this. So, yeah.
Okay. Yeah, she's on our board. She's with, it's a funny name, Chagrain something. I can give you your info if anybody wants it. I can put it in the chat box.
Yeah, and any elder law attorney worth their, their degree on the wall should be able to help with Medicaid estate planning. The key is make sure you like them, you trust them when you meet with them. Most of them will give you a free 15-minute, consulting appointment. I talked to one just the other day that said, if he gets somebody that comes in and it's a very simple estate, they don't really need to pay an attorney to do the application. He'll, just kind of say, here's, sign this and fill these papers out, and, they don't charge you. So it's worth asking.
Hang on, just had her.
So do we have did you say we have 7 people on the call tonight?
No, we had like 19.
Oh, okay. I was just curious if any were from the Grand Traverse area.
I saw Linda was on it. Linda, I don't know if you're still on or not. I saw somebody who I know for sure was in.
Okay.
I can't paste this. She's put this she's got it in a text back, darn it.
Best intentions.
Yeah.
Well, I was going to point out to those in the Grand Traverse area that our Parkinson's group has an exercise class at the senior center that we actually started at PACE during COVID, and has about, 20, 25 people that go to that class. So we feel pretty proud that started at PACE. So it got too big for us. We weren't able to.
There she is. Okay, let's see. Bear with me. I'm really struggling tonight. There we go. Okay. I just was on their website, and they've got offices all over Michigan, her law firm. This is, she works out of our Southfield office, which is near our office, but like you said, she'll do about a 15 or 20-minute consultation, and everybody we've sent to her has been happy, and she will do a presentation for us on Tuesday evening. I'll get her on the calendar. Okay.
Great.
Hey,
That'd
Gwen.
be great. I would love to know about that appointment. I would come to that too if you would allow me to.
Okay, sure.
Great.
Absolutely. Yeah. Hey, John, do you have a question? Look like you're raising your hand. No?
Just waving.
He's just waving. Okay. All right, folks. We're past 8 o'clock, unless there's any other questions for Lori. No? Okay. I'm going to say good night. Lori, thank you so much. This was really informative, really helpful.